It is my great pleasure to introduce Stuart Greenberg and Mark Stone to the show. Welcome to the show.
Thank you, Steve.
Thank you.
One of the clients that you're representing in the case we're going to talk about today is Lazaro Perez. Tell us a little bit about what happened in this case.
This was a tragic situation. Back in 2003, Lazaro had a pain in his stomach, and he went to a local emergency room called Palm Springs Hospital in Hialeah, Florida. They did some studies on him, and they said that he had to have his gallbladder removed.
Which I understand a lot of people have not gallstone surgery every year, but a lot of people have gallstones.
Correct.
Every year, which cause pain in their abdomen.
Correct. And in his case, actually, he really didn't need to have it removed, according to the experts that we had hired in the case, but the surgeon that the hospital provided for him said you need to have it removed, and he was going to do it laparoscopically.
And this was the on-call surgeon at the time, whose name was?
Dr. Juan Pombo Hernandez.
Okay.
And they scheduled our client for surgery, and he performed the laparoscopic procedure. The day after surgery, they sent him home.
Which is typical in cases like
Correct.
this, right? Okay.
But what happened in the few days after that was he all of a sudden developed pain in his abdomen and jaundice. So when he went back to the emergency room, to the hospital, they realized something was wrong. And normally what happens in a case like this is the doctor makes a mistake and cuts the wrong duct when he removes the gallbladder. And this doctor cut the duct, the wrong duct, and there was bile spewing into his stomach. And bile is very acidic. So it was causing an irritation in his stomach. Instead of then sending him to a specialist who could resolve this issue by probably putting a drain in, draining out the bile, letting the stomach and the organs cool down, this doctor decided to admit him to the hospital, do some tests, and without the qualifications to do so, operated on him a second time.
Now, he had the authorization from the hospital to do this.
Yes, he did. Although he really had no experience ever doing these procedures.
I understand he only had, this was a second operation or something like that?
The second operation of this type he had ever done in his life.
And the other operation, he had been sued by the client, right?
That's correct. It occurred in the Midwest. And the second operation he did on our client did not go well. And he did a third operation on him for 8 hours, which didn't go well.
Now, normally in a hospital, I mean, you've got a patient. I mean, the hospital administration has got to be saying to themselves, if they have a review board, wait a minute, we brought a patient in, it didn't go well, we had another operation, didn't go well again, we had a third operation. They're kind of thinking liability here, aren't they?
You would think.
But in this case, they weren't.
You know, it's hard to think what they were thinking. They allowed this doctor to maintain treating this patient and doing what he wanted to do, when they should have said, get him over to the University Teaching Hospital as soon as possible.
What happens next?
The family insists he's dying. He's in intensive care. He doesn't know what's going on. The doctors basically throw up his hands up and says, I don't know what else to do. They say, well, let's get him over to the University of Miami Jackson Memorial Hospital. It takes them 7 days to transfer a critical patient.
Why is that?
We don't know.
Don't they have, is it Jackson Memorial? They have an emergency room, don't they?
They sure do. And
anybody can come into an emergency room, right?
Yes, they can. And Jackson is very good at accepting patients who have had problems elsewhere. When they finally get him over to Jackson, and he's looked at by the Jackson physicians, the Jackson doctor on call asked the family, in what third world country was he operated on?
Right.
They couldn't believe what they had seen. And it took them 6 months and a number of procedures to finally make this man better than he was.
What is his condition today?
He no longer has a colostomy, thank goodness.
He had that temporarily.
He had that temporarily. But his condition is such that he is at risk for a blockage for the rest of his life. So in order to avoid that or to check on it, he has to undergo tests once or twice a year under general anesthesia. And as a result, he may need to have a kidney transplant in the future.
How did he come to you to have you represent him?
One of his family members came to us when he was so sick. After they had gotten him into Jackson and after they were working on him, the family realized that they needed someone to fight for him.